FM, also streaming from that SuperTalk Mississippi app and your local SuperTalk Mississippi radio station. You can watch us too. We are on your computer, your mobile device. Just head on over to SuperTalk TV. Now, September is Suicide Prevention Month. Tough topic, but we've got a good guy here to talk to us about it, Dr. Clyde Glenn, board-certified psychiatrist over the last 35 years, but also works with Behavioral Health Medical Director at TrueCare Mississippi, and the founder of which services? How do you say that?
Rehoboth.
I was like, I ain't even going to try that. That has to have a special meaning. What does that mean?
Well, it actually means spacious and wide, but there's a more expanded definition religiously. It means God has found a place for us and we shall be fruitful in the land.
I like that. And I would have never gotten it right. But I think this is great. And I do think this is a tough topic, and some folks tend to roll their eyes or huff or puff. But if your family's ever been impacted by mental health or suicide, then you recognize the need to keep talking about it, right? And keep bringing it up in conversation. So, Dr. Glenn, when you see like September being a month of awareness, that seems kind of odd. How are we supposed to bring awareness to suicide prevention?
Well, I think the first step is simply to talk about it, to acknowledge it, and to recognize that it is a phenomenon that occurs in our communities. It happens and affects all walks of life. And I think being willing to at least engage in conversation certainly raises awareness and potentially could save a life.
You know, we talk a lot this week about opening communications or having places to have like safe conversations. Is this one of those topics where people need to feel like they can have a space for safe conversations around it? It shouldn't be polarizing. There shouldn't be stigmas around it.
I certainly think so. I think safe spaces are very important, and I think probably the primary space should be family. You should feel very comfortable with being able to talk to family about various challenges and situations in life, and even if one is contemplating, so that strategies and decisions can be made to assure that safety is the outcome.
When we think about families, you know, you think about children, and I know parents, I have a 13 and a 6-year-old, and I say it all the time to my mom, this is just a different world than you raised me in and all the things, and it's true. But there's sometimes where you want to protect them or keep them children as long as possible, and you feel like heavy conversations like this, you know, is there a right time or not? Do you allow it to like when you're thinking about awareness and having these safe conversations or safe places with your children? How do you ease into that, Dr. Glenn? I recognize if a friend at school or a classmate at school or a family member or somebody in their circle, you know, walks that the suicide comes up, that obviously opens the gate a lot sooner. Sure. But just in the fact that, you know, there's a month for it now, and there's people using the word, and it's coming up. How do we help our kids kind of navigate that? Because I don't remember growing up hearing that word much. I was fortunate that it wasn't something in my circle, small circle, to have walked through, so I recognize that's different. But you know what I'm trying to ask. It seems like a tough topic for kids.
Yeah, there's probably no, I guess, ideal age that I can specifically point to. But given the fact that suicide issues are prevalent in society, it's very much likely that kids will come across the term and may want to know more about it. But I think the foundation that should be established in families is an open environment where any subject and topic can be discussed. And every so often, I guess parents are just challenged with the responsibility of these are things that are happening out here. I may not be able to shelter you from things that your friends may say or things that may come up in classrooms or on buses or whatever the case may be on the playground. So it's important for us to talk about this. And it's important to talk about it because suicide is one of these phenomena that knows no age boundary. A few years ago, I think it was around 2019, the CDC even issued a public health warning regarding suicide in ages 5 through
That's
10.
terrifying.
Even. And one would obviously question what is going on in the life of a child that young that would cause them to actually try and take their lives. And these were not accidental suicide attempts or suicide gestures. These were individuals who were actually truly attempting to take their lives, and many, many did, unfortunately. So I think you just have to kind of weigh the environment, the potential for kids being exposed, and decide when to have the tough conversations.
What are those red flags for your, 5 feels real young and probably rare, but your 10 to, preteen, teen, young adult, well, I know I can see how life gets heavier as a young adult. I'm thinking 10, 11, 12 still feels too baby, but what are those red flags for parents to not put their head in the sand about?
Yeah, well, certainly if a child is less engaging with the environment, withdrawn socially, isolating themselves, not wanting to play with friends any longer, not interested in their favorite toy or haven't replaced that with something else. I think kids can become a bit challenged by their peer groups, so it's important to have conversations and ask kind of open-ended questions. How are things going with you? How's your day? What are your friends like? Do you have any new ones, etc.? Yes. You have to pry. You have to probe. But certainly changes in sort of that baseline way of behaving and engaging the world. When you see changes there, that's a red flag.
Especially now,
you should start asking questions.
You can't take it. You can't just risk overlooking it these days, as they would say. Going back to the safe spaces, what role does faith community organizations play in this? Because I would say too, you would think you could come to your churches, and in some instances there are great churches out there that have safe spaces to talk about it, but there's still a stigma attached to suicide when it comes to religious places, which I'd love to see change. That's the one place you should go for comfort and help. So how can your churches or your faith communities kind of open their hearts a little to have a little safer space?
Yeah, well, the faith community certainly plays a very powerful role in preventing mental crises, because in most cases they are trusted spaces. They are made up of individuals who have access to our lives, and they're deeply rooted in the day-to-day routines of our lives. So their influence certainly extends beyond just the spiritual and topples over into our social well-being and social areas of our lives as well. As far as reducing stigma is concerned, I think the faith communities certainly have to be willing to normalize conversations about mental illness, for instance. I mentioned earlier the first and primary thing is to actually start talking about it, to make it known, and to, I think, sort of break the silence, if you will. And by doing so, it will certainly free some individuals to share more of the challenges that they may be having in those particular areas. I think faith leaders have to be a bit more forthcoming regarding challenges that they may have had in their own lives and what they may have done to seek help. In addition, when leadership is challenged and they feel inadequate, they really need to refer people on to the appropriate services as well. But I think clearly educating the congregation and just the faith community as a whole, being open, willing to listen, willing to extend love and compassion, and to show concern is what is needful and necessary in order for individuals to feel
Talking about the right
comfortable.
resources, Dr. Glenn, what are some of those resources that are available to people if they find themselves in a crisis right now, or maybe has a family member struggling?
Sure. Yeah, well, one resource that is available nationwide is the 988 Suicide and Crisis Lifeline. That is a free line that can be called or texted, that 988 number, and the individual will be connected with a behavioral health or resource here in the state, and they'll receive instructions as to what's next and what they can do to really get the crisis under control. Of course, there are mental health centers, community mental health centers that are available. There are private psychiatrists, psychologists, therapists, nurse practitioners, etc. So there's a number of resources that are available in the community. Oftentimes, the issue is people simply not accessing them.
Well, hopefully we've started the conversation today, Dr. Glenn. I appreciate your time here on Good Things.
Thank you.
All right, you guys
Glad
stick
to
with
be
us.
here.
We got more for you coming up next.